Kennedy's disease, also called spinal and bulbar muscular atrophy, is a rare inherited disorder that slowly weakens muscles, especially those used for walking, speaking, and breathing. Think of the nerves that tell your muscles to move as phone lines. In Kennedy's disease, these lines become fuzzy over time, so messages get lost. The disease is caused by a change in a gene on the X chromosome called the androgen receptor, a R gene. The gene gets a repeat of the letters C a G, many more times than normal. This extra repeat makes the protein act strangely, damaging the nerve cells that control muscles. Because the gene is on the X chromosome, mostly men get the disease, while women are usually carriers. Typical signs include gradual muscle weakness in the legs, making climbing stairs harder, tremor or shaking of the hands, especially when holding objects, difficulty speaking or swallowing, like trying to talk while chewing gum, shrinkage of the testicles and reduced sex hormones, which can cause low energy. These symptoms appear slowly, often after age 30, and get worse over many years. Doctors diagnose Kennedy's disease by checking family history and looking for the typical muscle signs, doing a blood test that measures the number of CAG repeats in the AR gene, performing nerve muscle studies EMG to see how well the nerves fire. Treatment focuses on managing symptoms because there is no cure yet. Physical therapy to keep muscles strong and joints flexible. Speech therapy for swallowing or speaking problems. Hormone replacement if testosterone levels are low. Medications for tremor or pain as needed. Since the disease is genetic, the best way to prevent it is through genetic counseling before having children. Couples with a known carrier can discuss options such as prenatal testing or in vitro fertilization with genetic screening to avoid passing the faulty gene to the next generation. Recent research is looking at ways to silence the bad version of the R gene using RNA-based therapies, similar to how some COVID-19 treatments work. Early laboratory studies show the approach can protect nerve cells, and a few small clinical trials are now testing safety in people. Scientists are also exploring drugs that boost the cell's cleaning system autophagy to remove the toxic protein buildup.